Hi, my name is Austin Williams, first year athletic training student here at UNI. What seems to be the problem?
My knee hurts really bad.
Okay, when did it happen and what'd you do?
It was during the third quarter of the state championship. I got the ball handed off to me. I was running, just turned, took a cut, and just went down in pain.
So you were planted and trying to change directions and went down?
Yeah.
Okay, did you feel a pop or a click or hear anything?
Kind of felt like something snapped maybe, and I just went down.
Have you done anything like this before?
No.
Okay. Have you had any other knee injuries or knee pain problems before?
Nope, never.
Okay. Can you point to the pain with one finger for me? Where it hurts the most?
They're back here the most, but pretty much all over.
Okay. On a scale of 1 to 10, 10 being you're in the ER and you can't move because so much pain, and 1 being that there's just a little irritating.
About an 8.
Okay. What kind of pain is it? Like burning, itching, scratching?
When it first happened, it was really sharp, and then right now it's just kind of throbbing.
Okay. What makes it feel better or worse?
When I straighten out my leg, kind of relieves a lot of the pain. And then when I bend my knee and start walking, it hurts quite a bit.
Okay, and it's your right leg, or your left leg, right?
Yeah.
Okay. Alright, Nate, this is the Acoustic Knee Survey. We're going to use it to track your progression, see what is painful, see what you can and can't do, and just fill it out as best you can, alright?
Alright, thank you.
A few moments later.
Okay, so you say you have swelling in your knee, you can't fully bend your knee, you have daily pain, you're going up and down and walking on a flat surface hurt a lot,
Yeah, it's a no-go.
getting in and out of a car, and getting in and out of the bathtub, you said hurts. Squatting, running, jumping, and twisting all hurt as well. And you're aware that you have a knee problem constantly.
Yep. Alright, I'm going to observe your knees. So, I'm looking for any swelling or deformities between the two knees. The injured side, the left side, has a little more excessive swelling, but there's no deformities compared to the two. I'm looking for a patellar alignment as well. Can I have you slide down the table? Alright, can I have you extend your knees, so kick them out towards me nice and slow. I'm watching patellar tracking here. Alright, they seem to be the same bilaterally. Alright, can I have you hop on up? I'm going to have you try to walk to the wall the best you can back. I know I'm observing the walk. I see a limp on the injured side. He's struggling to flex his knee, probably due to pain and swelling. Do you mind if I examine your knee?
No, that's fine.
Okay. Right here. We'll start down here on the tibia, on the non-injured side. Over here, compare. Already pain?
Mm-mm.
Okay. Towards the joint line, each knee. I'm comparing bilaterally, just to see if there's any differences. The femoral condyle, lateral and medial. Patella. Patellar tendon. Up here on the quad tendons. LCL. Alright. For the LCL, I'm going to have you cross your foot into a figure 4 for me.
Okay.
I'm going to start with this one, so that way you know what I'm doing. I have them go in this position because you can feel the LCL. Alright. This feels too uncomfortable, so let me know.
Nope.
Okay. MCL. Alright. Were you having a whole lot of pain when I was palpating your injured knee compared to your other?
No, just
From
a
the
little
front?
bit on the joint line.
Okay. This is your injured side here. I'm palpating the gastrocs right now. Work my way up to the popliteal fossa. Any pain up in here?
No.
What about right here?
A little bit, yeah.
Alright, I got the hamstring tendons. Compare bilaterally.
All right, next I'm going to measure your range of motion, so seeing how far your joints are able to move. First, we're going to start with hip internal and external rotation. So what you're going to do is you're going to be sitting like that and move your hip, your foot out, and then your foot in.
Okay.
Got it? All right. Starting with internal rotation, I'm going to have you bring your foot out. All right, sorry. And then bring your foot out this way as far as it can go. All right, you can relax. Getting 18 degrees there. And for external, bringing your foot in this way as far as you can. All right, and you can relax. 15 degrees for external rotation. Other leg. And for internal rotation, bring your foot out this way as far as you can. All right, you can relax. 19 degrees there. And for external, bring your foot in as far as it can. All right, you can relax. 20 degrees there. Next, we're going to measure your knee extension, so just completely straightening out your leg. But first, lay on your back. Starting at 4 degrees, can you straighten out your leg any farther? All right, you can relax. That would be 2 degrees there. Moving to the other leg. Starting at 3 degrees on this side, and can you straighten your leg out? And you can relax, going to 5 degrees. All right, next I'm gonna measure your knee flexion, so just kind of bringing your foot in as close to your back as you can, so I'll be flip over onto your stomach. All right, and just bring your foot up as close towards the back of your leg as you can. And you can relax. We're at 110 degrees. Moving to the other leg. Same on this side, bring your foot up as close as you can towards the back of your leg. And you can relax. 108 degrees on this side. So all of your ranges of motions were normal except for external rotation on your left side. The injured side was just a little bit weak compared to the others.
All right.
Ready? Okay, next I'm going to do manual muscle tests, so just testing the strength of your muscles. First, we're going to start with the popliteus muscle. So what you're going to kind of do, I'm going to hold your leg down, and you just want to bring your foot in and out. Got it?
Okay.
Okay, we'll start on this side. Can you kind of rotate more this way? There we go. All right. Give that a 5 out of 5. All right, let's try the injured leg. Same thing. Can you
Nope.
do it at all?
Nope.
All
Nope.
right. Giving that a 2 out of 5. Next is, we'll do the quads. So just, you're gonna extend your leg out and I'm gonna try to push down on you, okay?
Okay.
So try to extend your leg, bring your foot up towards me. All right, 5 out of 5 for the good leg. Same on the injured leg. Try to bring your foot up towards me.
Nope.
Nope. Okay, giving that a 3 out of 5. Next, I'm gonna have you lay on your back. All right, and we're gonna test your sartorius muscle. So if you wanna look at me, I'll show you. Just kind of make a figure 4 with your leg. Just do it
Okay.
on this side first. There you go. All right, and you leave your leg like this, and I'm gonna try to straighten it out.
Okay.
Ready, go. All right, so this side's a 5 out of 5. Injured side, can you make that pose again for me? No? Okay,
little
you
bit.
can relax. Give that a 2 out of 5. All right, last one, laying on your stomach. So next we're going to measure your semitendinosus, semimembranosus muscle, starting on the non-injured side. We're going to bring the knee up a little bit and out. So I'm going to press down on your leg and you press up into my hand. Ready, go. All right, you can relax, 5 out of 5. Now on the injured side, same thing, bringing it out. Then I'm going to press down on your leg and you press up into my hand. Ready, go. All right. Weak and painful?
Yep.
Give that a 3 out of 5. Last one, bicep femoris. So bring your leg up and in. Same thing, I'm going to press down on your leg and you press up into my hand. Ready, go. All right, nice, 5 out of 5. And on the injured side, bring that leg in for bicep femoris. I'm going to press down on your leg and you press up into my hand. Ready, go. Painful?
Yeah.
All right, you can relax. 3 out of 5 on that one. So next we're going to do some special tests so you can kind of figure out what's wrong with you and what structures are injured. So if
Okay.
you want to sit back and extend your legs. So on the non-injured side, just tibia and fibula compression and femur compression. Any pain with this?
Nope.
All right, so negative test on the injured side. Any pain with these?
Nope.
All right, so we can rule out a fracture. Next, we're going to do posterior Lockman. So just try to relax your leg for me, please. No posterior translation, so a negative test there. Negative test for the posterior Lockman on the injured side. Alright, so next we're going to do the quad activating test. I'm going to have you bend both your knees with your feet flat on the table. I'm going to hold your feet down and you're going to try to extend your legs for me. Ready, go. Alright, you can relax. So first we're looking for posterior sag, which there wasn't any. And then on the injured side we saw a little anterior translation. You can relax. We're going to do anterior Lockmans now. So no anterior translation on that side, so it's negative. And on the injured side, we're seeing lots of anterior translation, so that would be a positive test. Testing valgus now. Negative test for valgus on this knee. And for varus, on the injured side, valgus, getting a negative test in varus. Negative test there. Now for the medial lateral grind test, just gonna bend your knee all the way up here. Any pain while I do this?
Mm-mm.
Okay. On the injured side, same thing. Let me know if you feel any pain. No popping or clicking. So a negative test there. So after performing this assessment, I'm sorry to tell you, I think you have an ACL tear. I'm sorry. So what I'm going to tell you is please stay off of it. No running, walking, jumping, and no participating in sports. I'm going to refer you to a doctor for further imaging and testing. And after this, I'll notify your parents of what's going on. And I'm also going to give you some crutches, so please use them until you see the doctor. And again, stay off of it. If you want to take some ibuprofen for the pain, ice it, you can. Otherwise, here are some home care instructions for you and your parents to follow.
Alright, Kenzie, so we're getting towards the end of your treatment, and I'm just going to do a little functional assessment on you to see if you're ready to play again. So first we're going to do 5 minutes on the cycle to warm up.
Okay.
Alright, how'd that feel?
Good.
Good? Alright, so now we'll do just a little bit of sprints. So if you want to come over here. And then we'll have you sprint to the wall and back 3 times.
Okay.
Yep. And pick up the pace in the last one. The first cutting drill, we're going to have you run to the first cone, shuffle across to the second cone, back pedal to the third, shuffle back to the beginning. You're going to do that 2 times.
Okay.
Okay, feel strong? Does it feel
Yeah, feels good.
weak or popping, no catching?
Mm-mm.
Good deal. Alright, for the first drill, we'll do 1 foot every hole. So when you're on third, just you're gonna do it as fast as you can. Okay, on the way back, do 2 feet every hole.
Is this right?
Yep.
You messed up.
And then now, 2 feet every hole with hopping through. Yep. And now, 2 feet every other hole hopping. And for the last one, we'll do a slalom. So you start here, go like this, all the way through.
And this?
Yep.
Alright.
Okay. And then, yeah, we can just do some jumping stuff. Maybe we'll be fine, right?
Yeah.
So that's what we're just gonna have you do some jumping stuff. So we have the box jumps here, and then jump up, come up fully. So extend your legs fully, and jump off, jump back up, way up, and do that 10 times. feel bad about that? Hurt or anything?
Nope, that's
Alright,
good.
Good. Okay, from the lateral side, you can see that she has some genu recurvatum in her knees. Alright, and cut. Almost. Ready? Alright, again, from this view, everything above the knee looks pretty good, normal. And then you can see the arches of her feet falling in this view as well. And all of her toes are also in alignment. Doesn't have hammer toes or anything like that. From this angle, you can see that everything above the knees looks pretty good, but then if you look down at the feet, she's got some pes planus and the arches of her feet are falling in. Okay. Okay, so we see that her first ray is pretty close to being parallel to the ground. And now Kenzie, just stand up on your toes. And that arch does reappear when she plantar flexes the ankle. Mm-hmm. The duration of the complete walking cycle seems to be normal. And her pelvis has no abnormal tilt or rotation. Her hips have normal rotation. The trunk is in phase with the pelvis. The upper extremities are swinging with or opposite of her legs. There's no abnormal bowing of the femur or tibia. Her feet are a little bit splayed. There's no abduction or circumduction of her swing leg. There's no atrophy of the quadriceps or the tibialis anterior. And her base width is a little bit narrow. Okay. Okay. Initial contact is almost full extension. Mid stance, flat, her foot is flat. Terminal stance, normal ankle flexion, plantar flexion. Swing phase, the ankle is plantar flexed during the initial swing phase. And the movement between the hip, knee, and ankle seems to be pretty coordinated. Here are her shoes, and she says she tries to walk on the outside of her feet because she has flat feet. So the lateral side of the foot, or lateral side of the shoe is a little bit more worn. Then over here you can see where her arches have been falling in. And these are fairly new shoes, so the soles aren't worn out too much yet.